Hello and welcome to Third Eye Medical Education. Let's solve the MCQ of the day related to the kidney. So we have a 10-year-old boy who is brought to the clinic after his parents noticed swelling around his eyes and on the feet, especially in the morning. The boy had also noticed that his urine had turned smoky brown since a few weeks. Lab tests showed creatinine levels of 1.7 milligram percent, which are high, and BUN of 27 milligram percent. Urinalysis revealed proteinuria, hematuria, and RBC casts. So the three together are indicative of glomerulonephritis. Now there is a hereditary connection because the history states that his paternal uncle had passed away a few years ago due to kidney failure. In addition to the kidney problem, the boy was also diagnosed with high frequency sensory neural deafness on audiometry. Slit lamp examination of the eye showed a conical lens with anterior displacement. So there is an ophthalmic problem as well. So there is a renal problem, there is an auditory problem, and there is an ophthalmic problem. Now the question that they are asking you is, a kidney biopsy in this patient would reveal which of the following defects? The options are collagen type 4, fibrillin type 1, ascorbic acid, elastin, collagen type 1, fibronectin, laminin, and cadherin. Now, if you want to think through and understand and diagnose this condition, you can pause the video, think for a while, and then continue. In the meantime, I will proceed and give you the correct option so that we can move on to the discussion of this disease. The correct answer is choice A, which is collagen 4. Now this is a case of Alport syndrome, and Alport syndrome is a genetic condition due to mutation of type 4 collagen. This is very high yield. Now this is a very often tested question, and it is characterized by the classic clinical triad, which is made up of hematuria, sensory neural deafness, and ocular anomalies in the form of anterior lenticonus. So all you need to really remember about Alport syndrome is this triad, because this is so high yield and so easy to remember that I don't think there is any disease which has this extremely odd combination of kidney failure with deafness and ocular anomalies. So once you get this, the second connection that you need to establish in your mind is its relation to type 4 collagen. So I don't think that you should be missing this disease once you understand these fundamentals. The easy mnemonic to understand this is can't see, can't pee, and can't hear a bee. This is about the ophthalmic problem, this is the renal problem, and this is the sensory neural deafness. Now the genetics is very interesting. It could be either X-linked or it could be autosomal. 85% are X-linked. So you may as well disregard the autosomal part and let's discuss the X-linked mutation that we see. Now the X-linked mutation in collagen 4 lies in the subunit which is called as the alpha 5 gene. Now to illustrate this, you can see the triple helix of the collagen molecule. Collagen molecules are triple helical in nature, and their ends are made up of alpha 3 subunit, alpha 4 subunit, and alpha 5 subunit. Now, as we have defined here, the defect in Alport syndrome is going to be in alpha 5, which is going to be mutated. So you should remember this, because this is the second commonest act that is tested in Alport syndrome. Now we need to understand that the transmission pattern in X-linked Alport syndrome happens from an affected father to the daughters. The sons are unaffected. So this is a very interesting pattern of transmission, and I think if you know genetics, you should also be knowing that the daughters are affected if the father is affected. Now this is perhaps the single most important slide in this MCQ based disease, and you need to know this, and if you know this, you won't go wrong with any question related to Alport syndrome. Now normally if you look at collagen type 4, they have 6 isotypes, alpha 1 to alpha 6. Now in the embryonic kidney, the alpha 1 and the alpha 2 types of collagen predominate, while as upon maturation what happens is there is something called as isotype switching. Now this is a phenomenon you are familiar with in immunoglobulins or in immunology. A similar process occurs here where alpha 1 and alpha 2 are replaced by alpha 3, 4 and 5. Now in Alport syndrome, the real defect lies in a failure of isotype switching. Now this is a 24 carat question that you are getting, and this you should be able to answer. Now the same question that I have mentioned, the same MCQ that I have given you, can end with the question asking for what is the defect in this disease, and if failure of isotype switching is one of the options, then this is what you should be choosing. So the same question can be structured in a different way. So you should understand all these molecular pathophysiologic phenomena that lead to Alport syndrome. Now because of the failure of isotype switching, what happens is the weaker alpha 1 and the alpha 2 isotypes are retained. As an outcome, the glomerular basement membrane of the patient becomes disorganized. And how do you know this? This can be seen under the electron microscope, and we will see a picture of that very soon. Now the glomerular basement membrane is disorganized, and that is because of splitting, lamellation and damage in such a way that it looks like a basket weave pattern on electron microscopy. So this is a normal glomerular basement membrane, and this is the GBM of Alport syndrome. You can see the difference straight away. Now this is a very organized type of glomerular basement membrane made up of the central lamina densa, as you can see this, and lamina rara externa and the lamina rara interna. While as in Alport syndrome, you can see how disorganized the basement membrane is. This entire thick structure is the basement membrane. It's completely disorganized, and you can actually see the haphazard laying down of the collagen fibers, creating what is called as the basket weave pattern of Alport syndrome. Now what happens in such cases is they eventually lead to kidney failure in most of the cases. So it's very difficult to convince the parents or the patient himself to undergo a kidney biopsy. So a substitute would be to perform a skin biopsy instead. And the reason why that is equally good is because the epidermal basement membrane of skin will also show absence of collagen type 4 and in the alpha 5 subunit, which is diagnostic of Alport syndrome. The good thing about this collagen is it's present at multiple locations, and the defect is also going to be present at all the locations where this type of collagen is detected. So as I said, a skin biopsy is used when a kidney biopsy is not possible, as in the case of say an end stage renal disease. The clinical features are very characteristic. It begins in childhood or in adolescence, and the first sign usually is hematuria, and it is nephritic. It's called as glomerulonephritis. There is a family history of chronic renal failure, which we have seen in the MCQ. Males are predominantly affected between the ages of 5 to 20. Sensory neural deafness occurs and vision defects are present. The patient usually ends up with chronic renal failure by the age of 20, but the span is very big, right up to 50 years. So the sensory neural deafness is due to damage to the cochlea. This is the cochlea that we see. this spiral structure, and the only possible treatment that you can give is a hearing aid. The vision defects are in the form of anterior lenticonus. I think you can already see this, how the lens has become conical and it has been displaced anteriorly. So the lens protrudes anteriorly and forms a conical shape. Diagnosis is made by examination. Posterior cataracts are common. Corneal dystrophy is there. Maculopathy can exist, but the ophthalmic findings are usually asymptomatic, which means if you see a patient within the age of say 5 to 20 who has renal problems, especially in the form of glomerulonephritis, and the patient has deafness, then you should look for anterior lenticonus by ordering slit lamp examination of the patient. Now before we end, there is a disease called as the thin GBM disease, which is practically opposite to what we have seen in Alport syndrome, and we should know a little bit about this. Now this is usually autosomal dominant, it's benign, and there is familial hematuria. There are no sensory neural problems and there is no ocular defect. There is no kidney failure, and again the thin GBM is because of collagen 4 defect. Now this is a normal GBM. You can see a thin GBM here. You can see how thin it is. Compare this to the normal GBM and look at the GBM of Alport syndrome, which is thick and laminated, and it shows the characteristic basket weave pattern. I hope you will be able to solve all problems related to this important disease called as Alport syndrome. Thanks for watching.